Okay, just the setup for the Zonare for a patient exam. Push the on switch, rotate the screen, then adjust the height of the keyboard, wait for the machine to boot up, it takes 20 seconds. Enter the password from the keyboard and press set. The machine will automatically boot up on an abdominal fast preset with this probe, the C41 probe, 4 to 1 MHz curvilinear probe. To begin your exam, press New Patient, select the transducer by pressing Set. Select the exam that you're going to do by pressing Set on the drop-down menu. Enter the patient's details. Tab. When you've entered all the patient's details, the date of birth, the hospital ID and your operator, your name, press Exit and begin scanning. On the screen it gives you the patient's name, the date and the time, the preset that you're on, the details regarding the probe and whether you're using compounding, harmonics and the frequency, and the details regarding the image that you're about to scan, the depth and the frame rate. The minute you start, press the Optimize key once, briefly, and the machine will adjust for gain and TGC. Press again and hold down. The zone speed indication will change, and adjust the speed of sound to suit the patient. Next, adjust the depth with the toggle switch on the keyboard, and if necessary, adjust the gain on the B mode rotary knob. If required, press freeze, rotate the trackball to rewind to the image you require, press measure and set to do a standard distance measurement which will read out along the bottom of the screen. Then press store.
Show the story. Okay.
To send the image to the archive. Press unfreeze. If you would like to annotate on the screen, press freeze. Press the annotation button again on the keyboard. A list of words will come up on the LEDs which you can select from, or you can just type from the keyboard and press store. Unfreeze. If required, you may want to change the frequency. This is another toggle switch here. And it shows you on the screen the different frequencies you can select. The lower frequencies for greater penetration and the higher frequencies for better resolution. You can also use the software algorithms of harmonics to decrease artifact and compounding to increase resolution. If you want to see vasculature, press the C rotary knob for colour flow. Press B to return to normal scanning. If you want to measure an organ, make sure it's in the middle of the screen, press freeze, rewind, press your ruler, set, and make your measurement and store. At the end of your exam, on the top keyboard, press End Exam. It will ask you if you want to close this exam. Select Yes. And then when you go to the archive, along the top of the keyboard, you can select your patient, press Set, go to Export, press Set, select your USB stick and export.
Let's stop there because that's 6 minutes.